Gender dysphoria in children represents one of the most complex and sensitive areas of contemporary healthcare and psychology. This condition, characterized by significant distress arising from incongruence between a child's experienced gender identity and their assigned sex at birth, has garnered increasing attention from medical professionals, educators, and families worldwide. Understanding the nuanced nature of gender dysphoria in pediatric populations requires careful examination of its clinical presentation, developmental considerations, and evidence-based approaches to support and treatment. The clinical manifestation of gender dysphoria in children often emerges during early childhood, typically between ages 3 and 7, though it can present at various developmental stages. Children experiencing gender dysphoria may express persistent preferences for clothing, toys, and activities traditionally associated with a different gender than their assigned sex. They might articulate feelings of being in the wrong body or express a strong desire to be recognized as a different gender. These expressions go beyond typical childhood exploration or nonconformity to gender stereotypes, representing a deeper sense of incongruence that causes meaningful distress or impairment in social, academic, or other important areas of functioning. Distinguishing between typical gender nonconformity and clinically significant gender dysphoria requires careful assessment by qualified mental health professionals. Many children naturally explore different gender expressions through play, clothing choices, or behavioral preferences without experiencing distress or identifying as a different gender. Gender dysphoria, however, involves persistent, consistent, and insistent feelings of gender incongruence accompanied by significant emotional distress. The diagnostic criteria established in the DSM-5 emphasize the importance of this distress component, recognizing that gender diversity itself is not pathological, but rather the distress associated with incongruence may require clinical attention and support. The etiology of gender dysphoria remains incompletely understood, with current research suggesting a complex interplay of biological, psychological, and social factors. Emerging neurobiological studies have identified potential differences in brain structure and function among individuals with gender dysphoria, though these findings require further replication and validation. Genetic research has explored possible hereditary components, while psychological investigations have examined the role of early experiences, family dynamics, and social influences. However, no single causative factor has been definitively established, and the scientific consensus acknowledges the multifactorial nature of gender identity development. Early identification and appropriate support are crucial for children experiencing gender dysphoria. Mental health professionals specializing in gender identity issues typically employ comprehensive assessment protocols that include detailed clinical interviews, standardized assessment tools, and collaboration with families and schools. These evaluations aim to understand the child's gender identity development, assess the degree of distress, evaluate family dynamics and support systems, and identify any co-occurring mental health conditions. The assessment process often extends over multiple sessions to ensure accurate understanding of the child's experiences and needs. Treatment approaches for gender dysphoria in children have evolved significantly over recent decades, with current best practices emphasizing individualized, developmentally appropriate interventions. The World Professional Association for Transgender Health, PATH, and other professional organizations have developed comprehensive standards of care that prioritize the child's well-being and safety. These guidelines recommend a cautious, supportive approach that involves multiple stakeholders including mental health professionals, medical providers, families, and educational institutions. The concept of social transition has become an important consideration in supporting children with gender dysphoria. Social transition may involve changes in name, pronouns, clothing, hairstyle, and other social markers of gender identity. Research suggests that children who receive family support and are able to socially transition in supportive environments often show improved psychological well-being and reduced symptoms of anxiety and depression. However, decisions about social transition require careful consideration of individual circumstances, family dynamics, and community context. Family support plays a pivotal role in outcomes for children with gender dysphoria. Research consistently demonstrates that children who receive acceptance and support from their families show significantly better mental health outcomes compared to those who experience rejection or lack of support. Family therapy and support groups can provide parents and siblings with education, coping strategies, and connection with other families navigating similar experiences. Schools also play a crucial role in creating inclusive, supportive environments that can significantly impact a child's well-being and development. Medical interventions for children with gender dysphoria are carefully considered based on developmental stage and individual needs. For prepubertal children, medical interventions are typically not recommended, with support focusing on psychological and social aspects. However, as children approach puberty, the question of puberty-blocking medications may arise. These reversible treatments can provide time for continued exploration of gender identity while preventing the development of secondary sex characteristics that may increase distress. The long-term outcomes for children with gender dysphoria vary considerably based on numerous factors, including severity of dysphoria, family support, access to appropriate care, and individual resilience. Some children may continue to experience gender dysphoria into adolescence and adulthood, while others may find that their feelings of incongruence diminish over time. Research suggests that children who receive appropriate support and care generally show better psychological adjustment and life satisfaction, regardless of their ultimate gender identity trajectory. Current research continues to expand our understanding of gender dysphoria in children, with ongoing studies examining prevalence rates, developmental trajectories, treatment outcomes, and long-term well-being. This evolving knowledge base informs clinical practice and policy development, ensuring that children and families receive the most effective, evidence-based support available. The importance of creating supportive, inclusive environments for all children, regardless of their gender identity or expression, cannot be overstated. This includes fostering understanding and acceptance in families, schools, and communities, while continuing to advance research and clinical practice in this vital area of child development and well-being.